Bismillahirrahmanirrahim. Assalamu alaikum. I welcome everyone who are with me and who will join me later on. And I hope you are in the best of your health. And I also hope that you are coping with your educational matters very well in these days, and I wish everyone the best way of having education in these tough days, and I hope that you and your families are doing well. And it is nice to meet you again. And today's topic is about foot deformities and foot orthotics. So as you know that foot is extremely important part of the body, and it is basically a very vital part of the body. And foot is basically designed in such a way that it not only helps us to walk, but it also helps us to keep ourselves balanced, and it also helps us to keep our body safe from the ground reaction forces. So that means that foot is basically working as a shock absorber, as a stabilizer, and as a mobilizer. So that is the basic function of the foot. So as it is directly intact with the ground reaction forces and ground, so it is also very much prone to too many impacts and too many problems. So that is the reason that foot is designed in such a way that it can absorb a lot of pressure, it can adapt to the surface nature, it can twist, it can move, it can move sidewise, and it can basically take a lot of strain and stress from your body and the ground reaction forces. So if you look into the normal foot shape, you will find that you have three parts of the foot, the major parts. You have the phalanges, you have the metatarsal bones, and then you have the tarsal bones, which are the midfoot, and then you have the hindfoot, which is the calcaneus and talus. So if you look into the phalanges, there are three phalanges in all these four toes, small, and then we have the first, second, third, fourth, and then if you see the hallux, the big toe, we have only two phalanges, so the proximal is missing. So that means that the hallux is the big toe is basically attached directly with the metatarsal joint. So that's why we call this joint the metatarsal phalangeal joint. And this is the joint where we get the bunions, we get the hallux problems, and we have too many because it takes a lot of pressure from the ground. So you have the distal phalanges, you have the middle one, and then you have the proximal one. So they are in all these four toes, but the fifth one has only two phalanges. There are two small bones under the phalange, fifth toe, and the big toe, which we call the sesamoid bone. They are small sesamoid bones. They are basically for the more balanced purposes, because the big toe take a lot of weight. The tarsus bones are very important. You have the cuboids, and you have navicular, and you have also the cuneiform. So the navicular bone, which is a little more longer, so this bone is very crucial in the foot structure, because if these bones move anyway, then the foot collapses. So it is very important that the navicular stay in the right position. Then the metatarsals are basically longer bones, and they are more prone to fractures. So you will see in too many cases the fifth and the fourth metatarsals are more, they have more stress fracture and sometimes even actual fractures. If you come to the calcaneus and the talus, So the calcaneus and talus, they are part of the tibia and fibula ankle joint, which they form the ankle joint. So that's how the foot is structured. If you see foot from the bottom, then you have normally plantar fascias, which are connecting the plantar surface of the foot. Any inflammation in the fascias is called plantar fasciitis. Now the foot has a lot of tendons. That means the muscles are attached through tendons to the bones. But there are a lot of ligaments in the foot. That means that the bones are attached to bones through ligaments. Sometimes they also stabilize the joint, in fact mostly. So this is the basic structure of the foot. Now we will come to the deformation in the foot, that how the foot get deformed. Now foot get deformed by different means. It can be any traumatic cases, it can be any congenital, and it can be any progressive conditions. So if you come to traumatic, for example, a person has a fall and then he get a fracture of the tarsus bones, metatarsus bone, and the foot structure collapse, and then he can't bear the foot weight properly. So that causes deformation in the foot. Then the bone move from their places. The joint cannot work properly, and the muscles are active, so then it causes a lot of pain, stress, and strain in the foot. In some cases, there are congenital problems like clubfoot, for example. There's a calcaneus valgus, there's a varus feet, there are pes adductus, there can be cavus foot. So they can be by birth, and these are deformations. Then we need to correct these deformations through orthotics. Sometimes there are progressive cases, like you have rheumatoid arthritis, you have diabetic feet. So these feet change their structure gradually because of different elements. For example, a poor blood circulation or a poor musculature that cause the collapse of the whole foot, and then there are tremendous weight distribution issues, and the patient cannot walk properly, and there are problems. So if we see the normal foot structure, in normal foot structure we have a very good weight distribution system. That means then most weight is taken on the calcaneus, which is normally 50%. So if we have 50% on the right, 50 on the left, then on the right side we take 20% on the calcaneus, the heel bone, which is nicely cushioned. This is a normal circumstances, but in this circumstance, in this situation, the foot has also arches, which are basically designed to redistribute the body weight properly. So foot has three main arches. We have the medial longitudinal arc, which I can show you here. So we have the medial longitudinal arc. We have a lateral longitudinal arc, which is not very high, and we have the transverse arc between the head of the fifth and head of the first toe. So this is the weight distribution system of the foot. Now any changes in these arches cause improper weight distribution of the body weight. That means the foot start taking weight in the area for which it is not made. So that means that there are soft tissues, there are joints which are under tremendous pressure, and that can cause inflammatory conditions, that can cause pain, that can cause deviations, and that eventually all these ground reaction forces, they are absorbed in the wrong way in the foot, and then sometimes they transmit to the knee and back, and then we have a lot of issues. So this is very important that we keep foot in a very healthy position. That means that we have good musculature of the foot. Regular exercises for the foot are very important, including the calf and ankle. When the muscles are stronger, then the joint of the foot are stronger, and the foot is stable. Then you can walk for a long time, you can run for a long time, you can do a lot of activities, and that is basically very good for the whole body mechanism. But if the foot is weak, that means the joints are not stable, the muscles are weak, body weight cannot be borne for a very long time, the patient feels fatigued, and then there can be a lot of problems like stress fracture in the foot, sometimes muscle fatigue, body fatigue, and sometimes the collapse of the foot, and that basically affect your lifestyle. So it is important that you keep your feet strong, normal, and muscular, and they are good with the structure. So if you come to the normal foot deformities, like we are facing, the top of the deformity is the flat foot. Now the flat foot is basically caused by the laxity in the joint of the foot. Sometimes it can be by birth, because you can see that in the small children that the heel is very much deviated and the navicular is very much prominent. But in most cases, as the children they grow, because of the lack of activities, because walking on the hard surfaces, because walking not on the normal surfaces like sand, grass, or going to the mountainside, so that does not make the muscle stronger. The joint remains weak, and then as a result, the foot collapse, because as the person grows, the body weight is getting more and more, the foot is not getting strong, so the foot start collapse. But in adults, sometime, for example, if a person is diabetes or he has a rheumatoid arthritis, then again there is a structural changes in the foot, and that is because of poor blood circulation, that may be because of less flexibility in the muscles, that can be because of the less power in the muscle. So but we continue to walk, we want to have activities, then the foot collapse. So when the foot collapse, then we have a lot of issues, because then the pressure is on the abnormal surfaces, and as a result we have blisters, we have pressure sores, we have wounds, we have a lot of discomfort. So that is important that we take care of all this mechanism with which the foot is basically working. Now flat foot is a very common issue, and in a flat foot condition, there's a reduced arches. Mostly there's the medial arch is basically collapse. So we normally grade 1, 2, and 3 the flat foot. So grade 1 is basically like when the arch becomes very low. It is not completely collapsed, it is very low. The grade 2 is basically the foot is very much flat from the bottom when you take the footprint. The grade 3rd is we call pes plano valgus. That means the foot is basically twisted in valgus. The heel is twisted in valgus, and the medial aspect of the foot is collapsed. So we call pes planus and valgus. So we call pes plano valgus. So the pes plano valgus also cause knock knees and also humpback in too many cases, and also it causes inflammatory conditions. So it is very important when you see any foot which is collapsed, which is on grade 1, you immediately work on the foot musculature, and then if you think that there is a deviation of the bones, for example calcaneus, then immediately you recommend any insole which the person can use it for walking purposes. It is very important. Along with exercises, along with any other therapy, it is important if you see any collapse of the arch that you recommend insoles so the person can use daytime. That means there's no more progression in that condition. So that is a flat foot because it is a progressive condition. So it is very important that you contain the condition and you try to solve the condition, and it does not have bad impact on the rest of the body. So for this purpose, you have numerous options. You have full length insole which are flexible. You have hard insole which are custom made with a medial heel wedge if there is a calcaneus deviation. You have also softer version of insoles which are for sports purposes. Even diabetic patients, they can use them inside the shoes. So they realign the feet, they cushion the feet, they improve blood circulation, they give more comfort and relief. And for children is the same way, but we focus on children more. For example, if children they have flat feet and then you think that there is a pes plano valgus, then you should recommend medical shoes which are normally high ankle with a Thomas heel, stiff soles, pure leather, and then in these shoes you can always put a custom made insole in these shoes. So that means the foot is realigned from inside the shoes, but the shoes overall, it is supporting the foot in a very better way. It also prevents any sort of deformation in the knees and other part of the body. So looking at the foot deformation, you can always recommend the right type of insole. In some cases, we go also for the sandal with the closed back. Remember, in any foot deformation, any foot deformity, it is highly recommended that you go for the shoes which are closed from the back. We should never use shoes open from the back, because we need to control the calcaneus deviation. When the calcaneus is stable, then the whole foot is stable. So this is very important for children, for adults, for diabetic patients, for any other foot deformities, that you keep the calcaneus fixed. That is the fixation point, what we call it. In some cases, when there is a deviation and you want to have some more option, because sometimes small children, when they use shoes, they can't use one pair of shoes, or even adults. Then what we do, we make them the SMOs. So these SMOs are also very good to control the grade 3 flat feet, spleno valgus. Also very good for the CP children to control the mediolateral and anterior posterior instability. So these SMOs, basically, they can be put inside the shoes comfortably. So you can choose your own shoes, like a sports shoes, and you can put the SMOs inside, and it will work like a medical shoes. So flat feet is very important in normal children. In special kids, more important that we don't allow the progression. And for that, you need medical shoes, you need insoles, you need SMOs, you need also muscular strength, that means foot exercises. So all these elements can make the foot condition good. In the future, you will not have any severe problems in the foot and upper part of the body. In some cases, you will see that there is a deformation which is opposite of flat feet, we call pes cavus. So pes cavus is basically more dangerous problem than the flat feet sometimes, because of the high arches. We have tremendous pressure on the calcaneus and the forefoot. So sometimes the patients, they end up with the pressure sores, blisters on the heel and the forefoot. And the foot also shrinks, it becomes smaller, and because of the contracture in the dorsum of the foot. So it is very important that we prevent any toe problems. Normally there are flexion of the toes, and we prevent any blisters on the forefoot and heels. So for this purpose, it is highly recommended that we go for the customized insoles. That means we have to fill these arches with the customized insoles. When we fill the arches, then we redistribute the foot weight properly, and there's a less impact on the head of the toes and on the heel. Although the heel is very much cushioned with a lot of layers, soft tissues, but still we need to protect that from the ground direction forces. So be careful that most cavus feet, they are coming with lateral deviation. That means that a lot of cavus feet, they have excessive lateral contact. So when we have excessive lateral contact, then in these cases, then we go for the lateral wedge. I think explained that before, but I'll show it to you. So these are the lateral wedges. So wedge means that it is higher on one side, it is more thicker on one side, and then gradually it becomes zero. So if it is pes cavus, then you will always need a lateral wedge. That means the lateral aspect of the foot will be higher than the medial, so we can prevent the excessive contact, and we can also control the varus position of the foot. So this is another common foot condition which can basically make patients very troubling, but there's a solution with a custom-made device. Then we come to some toes issues like hammer toes, claw toes. These are also very common in too many patients, and the toes basically contract on the different interphalangeal joints, and then they are very painful, and the patient can't move. And it is very important that we relieve these joints, and the patient can walk properly. So for this purpose, sometimes along with orthosis, it's also very important that you stretch the toes gradually so you can make them soft. Number two, for these cases we have the orthosis, which are very effective. For example, there are claw toes, so we have these silicone crescents. So these crescents are basically kept under these toes, and they are basically restricting the flexion of the toes, and they keep the toes in extension. So that is very beneficial to the patient when they walk. So basically the toe expands. This is very useful. And in other cases, then we also use the this silicone pad, and basically the toe go inside this ring basically, and it pull it down. So it also make the toe straight. At the same time, it also support the head of the toes, so it also reduce the metatarsal pain, the forefoot pain in the patient. So in some cases, when there are these devices, they fail, and then we need a knife device for this case. So this is a splint which we designed for one claw toe, hammer toe. So it is worn for the night time. So basically it is fitted on the foot like this. So, and then the toe basically go in this tunnel, and then we wrap it. So the patient use it night time, so daytime his toe is in a better condition, and it also prevent further progression of the toe deformation. So toes full function is very important, because toes are very flexible and they move in different direction. They also twist, rotate. So if there is any stiffness, any deformation in the toes, then the patient cannot walk properly. Eventually the patient may end up with some sort of injury or pain or any blisters or wound, then he can't walk. It becomes more important in diabetic patients that you take great care of the toes. The toes are free of any wound, any skin breakdown, any friction inside the shoes. So that is very crucial to the health of the foot of the diabetic patient. So you take special care of that. We come to another very common issue in the foot, which is we call the hallux valgus or bunion. So you will see in too many cases that the big toe joint, it is basically deviated laterally, and that causes the hallux valgus. So if it is very mild, you can always use the toe spacer. You just keep it in between, so you can keep the joint in the optimum correct position. But if you think this is basically for walking purposes, but if you think that the problem is severe, then you can always use the hallux valgus splint. It's a non-walking device used for the hallux valgus while the patient is sleeping or when the patient is at rest. But sometimes when the hallux valgus, because every deformation has a primary reason, so in most cases the deformation is basically because of the pronation in the foot. When there's a pronation, then you need to make a customized insoles. So when you control the pronation, then you can also control the hallux valgus tendency. So these are few options which you can have for the hallux valgus. And hallux valgus is also very disabling and very painful for too many patients, because the big toe contributes a lot of weight. So when you take a lot of weight, if it is not in the right position, then the patient have a lot of pain. So now we will come to the middle foot. Now in the middle foot, basically we have normally deformation of because the arch has collapsed, whether the arch is very high and the arch is very low. So the midfoot is normally not affected like the heel or the forefoot. Forefoot is very flexible. We need flexibility when we walk in the stance phase and swing phase. But if you come to the middle foot, it is not basically contributing in the body weight taking process. So it is less. It has less impact from the ground reaction forces. But if you come to the heel, then the heel is more affected than the middle foot. So if you see the heel take almost 50% of your body weight. So a heel can have stress fracture. Heel can have plantar fasciitis. Heel can have calcaneus spur. Heel can have easily some deviation because of the excessive body pressure or the ground reaction forces. So the stability of the calcaneus is very crucial to your foot and your body alignment. So that is the reason that we always recommend there's any heel problem, that we recommend that you should use closed shoes with a stiff ankle, stiff heel part, so that can realign the calcaneus, and the patient is really very relieved from a lot of stress. If you use open shoes, when the heel twists in the open shoes in the back, then basically you can't control any sort of foot deformation, and that is a big problem for too many people. So even you can choose like shoes which are open from the front, but they must be closed from the back for the calcaneus stability. So for example, if the patient has a let's say calcaneus spur or plantar fasciitis, so it is very important that we cushion the heel. So we cushion the heel, and at the same time we also elevate the heel. So elevation can be done with the heel raise, a silicone heel. In the same time, it also cushion the heel. So that means that the heel will have less impact from the ground. So there will be less pain. At the same time, if there is a deviation of the calcaneus, then you can use medial or lateral wedges for the calcaneus. So sometimes the calcaneus bone has a spur. So the spur is normally to the medial side. So there are special heels which you have. They are medially more thick, so you can basically place under the heel. So they accommodate the calcaneus very nicely, and they have a special groove for the calcaneus spur, so the patient can walk in a normal way without hurting soft tissues. In other words, if the patient has a plantar fasciitis, you can always go for the plantar fascia stretching nighttime. That also helps to reduce the pain. So this is one solution for the heel pain. So heel comfort is very crucial in all the foot deformation, all the foot issues, because majority of the weight is coming on the heel part. So you can choose the right type of footwear. That is very important. Along with all these orthotics, it is important that when you choose the footwear, then you should know which kind of footwear basically match your biomechanical conditions. So as I said earlier, in all the shoes, it is very important that you have a proper heel height. So you will see in all the medical shoes you have proper heel. That means that the heel is basically for the elevation, cushioning, and it makes your body balance. It also helps in the initial flexion of the knees. It also helps the initial dorsiflexion of your ankle, so it makes the movement and mobility more easy. If you walk with the flat soles, flat shoes, then you have to struggle a lot, and then you may end up with some sort of issues. That's the reason that with all the medical shoes, you will see in all the shoes you will see a proper heel height, and that is very important for everyone to walk with. But it becomes more important for the having a foot problems, that you design the shoe in the way that it really solves your problem, and number two, it does not allow the problem to grow. That is very important. For example, if a patient is diabetic, for example, so normally in diabetic patients you have collapsed foot structure, you have poor blood circulation, you have improper weight distribution, there's a chance of blisters, there is a less sensation in the foot, there's maybe some shape problem of the foot. So that means a proper accommodation of the foot is must. So in these cases, then we come to the shoes which are really wide, like this one, and you can open them basically to the maximum, so you can insert the foot inside easily. And these shoes, they will come with some additional space inside. Why they come with the additional space? Because in case if you customize any sort of insole, so we have enough space for these insoles or any customized device, so we can insert inside, and we can control the foot deviation. Nevertheless, all these shoes which we make for the foot correction, they are made of pure leather, because leather is very strong. It can contain the foot shape, and it can also basically breathe, so the patient is comfortable. It is not putting a lot of pressure. So avoid any synthetic material, avoid any fabrics, avoid anything else than leather if you want to have a very comfortable footwear for the correction of foot deformities. Now, along with this, I will also show you this type of shoe. which are very high ankle. Now these are for adults. For any sort of like ankle or sub-ankle instability, you can keep really the ankle very high, unlike this shoe, which is a low profile. So this is a low profile heel ankle, and this is a high profile. So you can choose for your patient. If there is a ankle and sub-ankle instability, then you can choose the shoe ankle height accordingly. So unnecessarily using high heels is not good, because it may restrict the ankle movement for the patient. In the same way, these shoes are normally coming with the adjustable straps, because a lot of diabetic or rheumatoid arthritis patients, their feet swells. So sometimes they have less swelling, sometimes they have more. So in those cases, then you can basically adjust these straps and the patient will not have excessive pressure inside the shoes. So they're normally very rich with the space inside, so the patient is comfortable and the patient has no issue with the weight distribution of the body weight. So the conclusion is that if we have the forefoot deformations, we have middle foot, or we have the rear foot, the hind foot. Important thing is that we redistribute the body weight properly, we make the foot stable, and we don't cause more problems than what the patient have right now. Number two, it is also very important when the patient has any sort of deformation, that we advise them how to walk, when to walk, and how much to walk. So we cannot walk in a normal way if our foot is not normal. So always tell your patients, if they have toe problem, if they have any other problem, that you have to walk, for example, periodically. You need to walk for 5 minutes, 10 minutes, and then you need to take a rest. So you will not develop any sort of injuries or any other sort of in the foot. Number two, if the foot has a pain, it is basically a good sign, because the patient can complain to you, then you can solve the problem. But sometimes when the feet are painless, like in diabetic, then it is very difficult to know exactly what is happening, because the patient may not complain because he has no pain. But when you take his foot out of the shoe, there might be bleeding, there might be wound, there might be some other issue. So it is very important that you teach your patients when they have foot problem, children or adults, that how to use this shoe, how to overcome this deformation, and when to stop walking, when to start walking. So this is all about foot, and I hope that it was a useful presentation. And now if you have any question, I can answer your question. I saw some questions which I will try to see. Okay, so I can see from Aish Mirza, and the question is, what is the effect when we press our fingers and make sound? Does it affect joint? Yeah, of course, yes. I mean, normally when you're cracking the joints. It is not recommended by anyone. It is basically a bad habit. You can spoil your joint. It may give you some relief temporarily, but in the long run you can damage your joint, and I think you should not do by yourself, and you should also discourage other people. So let me see some other question. Then we have Mr. Manzoor Hamid. How we can find that a pes planus is structural or functional, and what will be our prescription for both? So Mr. Manzoor, if you know about the windlass effect, that is the typical sign of having to know that how much is whether foot is functional or structural. So windlass, when you extend the toe fully, then basically you can see the medial arc of the foot. So if there is a basically formation of the arc, it can be functional. But if there's no formation of the arc without body bearing, weight bearing, it is basically structural. Number two, you can always feel the medial aspect of the foot. If there is a slipping of the navicular bone medially, anteriorly and downward. So then it is normally structural issue. Otherwise, if the bones remains in the right places, it can be very much functional. In those cases when there's the bone, they have moved from their places, we need some stiff insoles, medially high, maybe with a little heel cup. But if the foot is very much functional, then we need a very regular medial arch, a flexible one, so the patient can keep inside the shoes, so the foot will not progress in the wrong way. Any other question? Ozair says, thank you. Okay, you are welcome. Manzoor says, for transverse arc, what will be the exact measurement, mean how lengthy and widely in modification? Yes, a very good question, Manzoor. Well, why we give transverse arch? Because the transverse arch is collapsed and the patient has a pain between the head of the fifth toe and between fifth toe and the first toe. So these three toes, the second, third, fourth, ideally they should not contribute in the weight bearing process, but due to some reasons the arch is collapsed, so we need to support that. So for such cases we have transverse arches basically, and you have to basically mark that point, Manzoor. So ideally you should the widest point is coming in the head of the toes, so you should keep the widest point covering these three toes and then going like a heart shape to the center of the central metatarsal, so it becomes like a heart shape. That means you support the foot maximum in the front and then it becomes narrower and narrower posteriorly to the back side of the foot. So that means that you relieve the head of the second, third and fourth toe. So that is basically the length. You have to cover almost the whole metatarsal, but you have to gradually finish it. And the width is as per these three head of the toes. So that is a normal procedure to determine how long and how wide your transverse arch should be. And then we have how we can reduce, the question is gone. Samreen Lagari, sir, which kind of, why we should, really I can't catch some question. If anyone feel pain, if you can write, what we use in the treat big toe lateral deviation? Ali Zubair. Lateral deviation, we use the toe spacer for walking purposes, which I have shown you. You keep between the toes, is for walking purposes. And then if there is a need, then you can use the hallux valgus night splint to control the deformation. And then you think if the deformity is because of the pronation, then you need a customized insole so you can control the foot pronation. That means then you can control the hallux valgus problem. Neha says, can you repeat grades of flat feet? Yes, Neha. The grades of the flat feet are three. Number one grade is that the foot is vertically collapsed. It's not completely collapsed, but the arch has gone lowered. It's grade 1. Number 2 is when the foot is fully intact with the ground vertically. There's no medial lateral collapse. That is grade 2. Number 3 grade is severe one. That means the foot is vertically collapsed and also it deviates medial laterally. So that is the very unstable condition of the foot. We call pes plano valgus, and that is the grade 3 flat foot. Karina says, why we should use silicone pad for heel? Silicone pad is basically for the shock absorption. If I can get it for you. Yes. So silicone heel is basically for shock absorption. For the elevation of heel, it gives instant relief to the heel pain. So any other question? Why we should use silicone pad? You got the answer. What is your suggestion for Leprosy foot, sir. Well, I think these feet are very sensitive and they need to be covered with the specific materials so they don't get any sort of irritation or any sort of skin problems. So there are some socks available which are gelled inside with the silicone. Maybe that is one option, but the silicone is sweaty. So there are some socks which are covered with the cotton from inside. We also use for diabetic patients. So maybe you can try those socks. Any other question? Puja? Okay, that's fine. All right, so any other question? How can we reduce the inflammation on the foot caused by a high uric acid level? Well, I think, Harim, you have to control the uric acid. But what we can do, we can reduce the pressure on the big toe inflammatory condition. We can take a lot of weight on the medial arc side, so we can relieve the big toe, so maybe the inflammation can get controlled. So by reducing the body pressure and the ground reaction forces, we can control the inflammation. Ozair says, what is the foot deformities are common in diabetic foot? So Ozair Saab, diabetic foot is basically a foot where we have lack of blood circulation, we have sensation issue, we have collapse of the foot, we can have blisters, we can have pressure sores, we can have wounds. And the main problem is that this foot has also sensation issue. So it is very important that we accommodate the foot properly, we support it very well, we pad it well for better blood circulation. So we realign the foot to the maximum extent so the patient can bear foot body weight. So that is the main idea in all these. Okay. So next question, when and how much to walk for plantar fasciitis? Fatima says, when and how much to walk for plantar fasciitis? If the plantar fasciitis condition is very painful, I think you need to use some cushioning material like a silicone or insoles and stiff soles. That will reduce the pain a lot. And then night time you need to stretch your plantar fascias so that eliminate the pain a lot. So I think you have to do all these two practices, then you can have less pain. If you have a lot of pain, then ideally you should not walk because you can increase the inflammation. Okay, then we have what happened if the arc angle is increased. Prince Raj, what happens if arc angle is increased? So when the arc is increased, that is the cavus foot, then you have tremendous pressure on the head of the toes of the forefoot, and then you have tremendous pressure on the calcaneus. So eventually you can end up with the forefoot inflammation and calcaneus pain. So then for these cases we cushion the forefoot and the heel, or we may customize insoles so we can take a lot of weight on the medial arc side so the forefoot is relieved. Shipra says that is silicone helps reduce uric acid pain? Yes, the silicone can reduce the pain in the foot, which is by any means. Okay, any other question? Mano says, which type of shoe are recommended for valgus and flat foot? For flat feet, we recommend shoes with the number one. We recommend leather shoes with the high ankle, with the Thomas heel, stiff soles, and anteriorly with a good opening. And then inside these shoes, we need to put a customized insole. So it will be a good shoe for the flat feet. Sabah says, should we give splint to a patient with the flat foot if it is not creating problem for him? Ideally, we don't give splint for the patient, we give them insoles. So you have plenty of type of insole, it depend upon their problems than any other person. Shalom Sadiq, you're welcome. Sahrish, she says, what is your suggestion for bilateral heel spur? Yeah, this is interesting. It is very rare to have bilateral heel spur, but if there is a bilateral heel spur, yeah. So I think it is important that in bilateral heel spur that we raise the heels, we make proper groove, and we accommodate heel spur properly, so at least the patient can walk. So that should be the ultimate, and it is very much possible, yes. Daneen says, how can we reduce inflammation of foot due to high uric acid level? Well, we can make basically a customized full contact insole to reduce the pressure on the inflamed part. So that's what we do normally, and it's normally very comfortable. Manzoor says, in pes cavus, as you said, we will cover the whole gap, means arch and also lateral wedge. So how it will decrease the elevation of the arch? Mr. Manzoor, we are not decreasing the elevation of arch. We are just trying to redistribute the body weight properly, because there's excessive pressure on the forefoot and the heel. So we want to keep the arch intact. So there's a maybe 15-20% of weight coming on the arch area, so the forefoot and the heel part is relieved basically, but we are not trying to reduce the arch. Any other question? Sabah says, should we give splint? I answered. Any question? How we can reduce swelling in the diabetic foot? So Angelique says, how we can reduce swelling in diabetic patient. To control the swelling, you need snugly fitted shoes along with the diabetic socks, so it can help to control the swelling in the diabetic foot. Feroz says, what is the best way to overcome flat feet deformity in CP? Yes, it is a very challenging in CP children to control the flat feet. So for CP children, we are normally using SMOs. So SMOs are doing better job than any other thing. So it controls the spasm of the foot. It controls the medial lateral collapse and anterior posterior instability, and this is the best option for the cerebral palsy children. Aisha Moghal says, what is spur? How we can reduce? Spur is a calcaneus spur. There's a like a sharp bony prominence in the calcaneus. So we can't reduce that, but we can accommodate. It can be reduced surgically or with some physiotherapy techniques, but we can prevent any sort of pinching the soft tissues which can cause more inflammation. So we can make them medical shoes, we can use them heel pad, we can use silicone heels designed to control the spur, not to damage the soft tissues. Maria Salim says, what to do when both foot is get inward shoe and not fit in, and also not flat? Yes, so maybe you mean the in-toeing and the feet comes inward. We call pes adductors. So the pes adductors you need to stretch outward. There are night splints available which you can use. So you can control the pes adductors with night splints. And then there are also shoes which we call the anti-adductor shoes. They are also very useful. So when you walk in these shoes, your forefoot remains outward and you are more stable. Another way, you can also do a lot of stretching to keep your forefoot outward. And otherwise, for children, sometimes we do also plaster cast to make sure that the forefoot is outward. Fariha Malik says, kindly repeat flat feet treatment. Flat feet is basically a combination of maybe muscular weakness, ligamentous weakness, and joint weakness. So you have to make the foot muscle stronger. It can keep the joint stronger. The joint is strong, then the foot is strong. Another way to control any progression, then we need medical shoes for flat feet, and we need insoles, a customized insole or maybe ready-made for your patient. So when they walk, then the foot is not getting worse. That is the main thing in flat feet, because children, they grow. So as they grow, if you're not using walking time, any shoes or support, so they can develop more problems. Shabana Khan says, any suggestion for the heel pain? Normally there is exercises, the foot stretching, night time. There are splints available which keep the foot in full stretch position. Otherwise, you can also stretch the fascias, which reduce the heel pain a lot. So, but maybe a physical therapist can answer in a better way. Okay, any other question? Hajira Noor says, what is the main reason behind the plantar fasciitis and how we can solve? The main reason of the plantar fasciitis is the lowering of the foot arc. When the foot arc become low, because the fascia on the plantar surface of the foot, so when the arches become low, the fascia is basically stretch and overstretch. So when you walk the whole day with a very low arc, so you can damage the fascia and they get inflamed. So solution is you have to give them relief with the custom-made insoles, a custom-made heel pad. That depends from case to case. And night time you have to stretch the fascias so they are more relieved. So we have a few minutes gone. Mirza Mohammad says, which shoe should we use during exercise curved foot? Curved foot mean like maybe pes. We also call sickle foot, which is like curved. So I think you need anti-varus shoes. We also call that anti-adductor shoes. These kind of shoes. This is the shoe. You see the forefoot is basically outward. So you can try with these shoes, or you can also use a customized splint nighttime, not for walking purposes, so you can keep the foot in the right posture. Asma says, is there any condition in the foot that nerve collapse or another one? Nerve may not collapse on another one, but nerves can be trapped. So when the foot structure is disturbed, it is a complex structure, and the nerve can be trapped, and then the foot is very much painful. So we need to release the stress from the foot, so we can release the nerve, so the patient can live normally. Any other? Is pes plenis correctable? Samreen says yes, is absolutely correctable. Strengthening foot muscles and prevent progression can help you a lot to correct flat feet. But of course it takes sometimes years, not months. Zeni says, if anyone can't walk properly while bilateral heel spurs, well, there are solutions for the heel spur. I mean, if you can customize the heel part with a proper medial wedge, with a proper hole in the medial side to accommodate the calcaneus spur properly. And at the same time, you have also silicone heels which are more thick and they are medially more high with a more groove in the medial side. The patient can certainly walk, even if it is bilateral. Any other question? Aish Mirza says, is the reason the kind of person fall more rapidly as compared to the normal person? Yeah, if there is a instability in the foot is going inward, the foot is flat, is chaos, any other deformation, certainly it causes imbalance, it causes fatigue. When you have fatigue, then there's a more fall of that person. Malia says that which heel sole is best for plantar fasciitis? For plantar fasciitis, we need stiff heel. So the shoe is stiff, the foot will not too much, there will be relief from the pain. And of course, outside the sole is stiff, but inside it must be soft. All right. So, any other question? Any other fresh question? Can you please show me the silicone pad again? Sabash say, yeah, this is a silicone pad. So the blue part is more softer than white. It's almost 1 centimeter thick, and it can be used in the any shoes. So I use these silicone soles, silicone heels in my shoes on a regular basis for running, for exercises, and they're very comfortable. You can try. Toba says, if someone has a calcaneus spur that leads to plantar fasciitis and flat feet too, so what do you recommend for her? So it is a calcaneus spur, plantar fasciitis, and flat feet. So I think first you should correct the flat feet. When you correct the flat feet, then hopefully there is no plantar fasciitis. And for the heel spur, you need to accommodate the spur properly. So it depends for how long the heel spur will stay. But there a proper accommodation of the heel spur can reduce the heel pain a lot. All right, any other question? You're welcome, Hajra. All right, so I think that's the end of the session. So thank you very much for being with me, and I hope it was useful. So take care of your feet, and also especially your elders at home, your moms, your grandmom, your grandpa. They must do foot exercises on daily basis. Even they can do exercise while they're sitting in the chair or in the bed, because that prompt blood circulation, it improves musculature. And nevertheless, as you know that we have two hearts in the body. The second heart is in the calf muscles. The calf muscles are called the second heart of the body. The more your calf muscles are stronger, the better blood circulation is. So calf muscle strength is very crucial to the foot and your overall health. So if your feet are strong, that means you can stand for a long time, you can walk for a long time, and eventually it can bring very positive changes in your life and your body. So work on your feet, and if there's a pain, less pain is very much fine. But there's too much pain, normally in the foot, the inflammation, then you must not do too much activities. Don't fight with your feet. If you have sprain, strain, anything in your foot, inflammation, don't fight. Give rest to your feet. When the feet recover, then start using them again. Because if you continuously use your bad feet, then basically you will end up nowhere, and then nobody can help you. So try to help yourself, help others around you. God bless you, and inshallah see you again. Thank you very much.